a basketball tryout for one of our own, and medics get a new training facility in Georgia. This is the Regional Health Report. Welcome to the Regional Health Report for May. I'm Ann Krebs. All Army sports promotes physical fitness. They also allow military members to play in national and international tournaments. Tryouts for all Army basketball begin this month. Ronald Harris spoke with a Troop Command Walter Reed soldier following his basketball calling.
Basketball has always been a part of Sergeant Jamal Thomas's life. His father played on the All Air Force team, and Thomas played pro basketball for 12 years in the NBA G League. After submitting an application, he has been invited to try out for the All Army team, and that's only the beginning.
Once you are selected, there is also a tryout. Last year, I want to say we had roughly 280-something applicants, which 24 were selected to attend camp for 2 weeks, which then the team was cut down to the final 12.
The balance between military duty and basketball is difficult. Thomas has the support of his troops and the command.
It's really great to see one of our soldiers, a Hornet, out there representing HHC, representing Troop Command, outside, in the Army, competing and doing these fantastic things. And then, of course, fitness and athleticism plays a big part into readiness, so that we can see that he is a soldier setting the example.
Sergeant Thomas made the team in 2018 and helped the team to win a gold medal. If his tryout is successful this year, he hopes to help the team do something special.
We're going for a precedented three-peat, which hasn't been done in the military in some time. So to be a part of that is very special. But it's just not myself, it's the guys that came before me to help start this gold medal trend.
Thomas credits his parents for teaching him values and the mental fortitude that has helped him succeed. And he offers a bit of advice.
If you want to get to this level, to put in the work, have the determination. You can be as good as you think you are, but trust me, there's always somebody out there better. And if they're not better than you physically, they may be mentally stronger than you. So strive for what you want. Make it your end goal. But also, don't forget where you come from. We're always soldiers first. The sports is secondary. Your job of being a soldier, defending this country, is primary.
The 3rd Infantry Division and the U.S. Army Medac Fort Stewart, Georgia, came together to officially open the Fort Stewart Medical Simulation Training Center, or MYSTIC. The center provides realistic battlefield conditions in a state-of-the-art training facility. Zach Renstrom has the story.
Medical simulation has been a part of healthcare operations for a long time. The opening of this new MYSTIC is incredible because it's in a 19,000 square foot space. It's not just valuable for the 68 whiskey, but all medical occupational specialties, as well as the combat lifesaver. This is a force multiplier on the battlefield that will help to save lives.
As an Army, we ask our soldiers to enter into harm's way. We ask our soldiers to execute dangerous combat operations to fight and win our nation's wars. Regardless of branch, MOS, rank, position, the need to be ready to rapidly provide medical care to a wounded soldier is one of the most important fundamental tasks that we all must master. When a soldier is hurt and needs life-saving care, there is no second chance. There is simply not enough time. Quite literally, a life depends on it.
It gives them the opportunity to actually hone their skills, because a lot of medical training does not occur at the unit level. So with this facility, we're actually enhancing the medical skills of the medics that are in the brigades, and also their combat lifesavers. It gives them a chance to work with them as well.
Pack them up now. You good?
We can train twice the amount of combat lifesavers in this building, in this facility, as we could at our old facility.
Everything here is state-of-the-art. They get to learn and practice on mannequins that bleed, they breathe, they got all types of injuries which they would see in combat. If they can save a life, they can treat it. And that's what we teach them here. It's facilities like this that actually instill those skills into the combat lifesavers and those medics downrange to where they saved their lives and brought them back to their families.
This MYSTIC right now, we are trying to make the model. So when they build those additional MYSTICs or further MYSTICs, they're going to come to this MYSTIC and they're going to say, we want our MYSTIC to be exactly like what they have at Fort Stewart.
I challenge all who come here to train to do so as if a life depends on it, because it absolutely does.
The Mystic is a validation training site for combat medical specialists biennial recertification and combat lifesaver training for the non-medical soldiers. In other news around the region, from Fort Rucker, Alabama, Mr. Luke Williams has been awarded the 2018 Captain John R. Teal Jr. Leadership Award in Medical Operations by the Army Medical Department. The award is given to military and civilians key operational positions who have made significant contributions to the Army Medical Department's mission and have performed in an exceptionally outstanding manner. Maria Yeager talked to Blanchfield Army Community Hospital's Chief of Occupational Therapy about how occupational therapists support the Army.
Our mission is to optimize performance and readiness, both in garrison and in operational environments, and that's to support the total force.
OTs are currently embedded with battalions working on the Holistic Health and Fitness Pilot, focusing on human performance optimization to improve readiness.
It's breaking down the activity and analyzing each step of what it takes for you to accomplish something, whether it's being able to achieve expert with your rifle, be able to effectively communicate with your platoon sergeant. We can use it in a lot of different functional ways, and it's just to improve your performance in your everyday activity.
In the hospital, OTs and OT assistants work mainly with patients with upper extremity injuries. They also support soldiers at the Warrior Transition Battalion and Intrepid Spirit Center.
And finally, congratulations to our 2019 Team Army as they prepare for the DoD Warrior Games June 21 through 30 in Tampa, Florida. Let's go, Army. And that's the Regional Health Report. Join us next month for another show highlighting health and readiness across the region. In the meantime, don't forget to check us out on your favorite social media sites, YouTube, and on iTunes. Thanks for joining us.